Hello, my name is Dominique Bennett, and I am a part of the Rasmussen Healthcare Systems. And I would like to discuss state healthcare reforms in reference to a possible expansion into another state for this particular company. I would like to discuss our current state, which is Georgia, and a possible expansion state of Virginia, their health reforms. Basically describing the similarities and the differences between those two states. Coming to a conclusion, making a recommendation as of what would be the best interest for our company. For Virginia and Georgia health reforms, they do have some things in common. The first one is the cancer plan that they both have. I found that very interesting because um, cancer is considered a chronic illness, and it is one of the most um, causes of death between these particular states. And so, with Georgia, it is the second leading cause of death in that state. And so, it is very important that there is a strategic plan set in place. And this was put together and, of course, implemented after the 21st Century Cures Act. With the 21st Century Cures Act, it did play a major role because it does allow the patients and the providers to, of course, get information regarding the drugs and the treatment of cancer. Also, it does allow the FDA to report on certain findings that they receive from patient experiences if the drug allows, them to report. And so it's very important as well to have mental illness health laws in place because that also is considered to be detrimental when it comes down to the residents that live in that environment. Um, if illnesses are not, tamed or if they're not treated, then of course they can lead to chronic illnesses. And so that does contribute to the quality and the access of care within that particular environment. As we are aware, of course, the Affordable Care Act does play a major role into everybody's health care now because it does mandate federally that insurance, of course, should be provided within each state. Um, and so with this, of course, Medicaid programs are available to those who are eligible. Um, and those of that who are eligible, of course, are women that's pregnant, a parent or guardian with a child under the age of 19. If you're 65 and older and you are blind, things like that does play a huge role into the eligibility of these Medicaid programs. And I found that both of these states do have similar Medicaid eligibility requirements. And so that is a very good thing as well. Um, when we talk about the differences between the two, I did notice that cancer, of course, was, a similarity, but Georgia did have a cancer state treatment program in which they did provide funding from the state to underinsured and uninsured individuals who, of course, have cancer and need treatment. And so I did find that very interesting, in which Virginia did not. Also, for Virginia, they did accept the Medicaid expansion. I found that interesting because um, it did help improve, of course, the healthcare access within that state. And so there's more preventative measures being taken, and people are more able to receive the health care they need at an affordable price. Versus for Georgia, it did kind of put stipulations on how many people can be in that Medicaid program, actually limiting the amount of people who can actually receive affordable health care in that state. And so if we expand to Virginia, we're looking at a state that has more access to healthcare. And of course, when there's more access to healthcare, people will use the measures they need to make sure that their health is taken care of. With the expansion of Medicaid, the federal government does allow more funding to be sent to that particular state for the expansion. And so that is very important. As a recommendation, I do believe that Rasmussen Healthcare Systems should expand to Virginia. As stated, that it will definitely allow for a better result in healthcare outcomes due to the accessibility for those residents who are eligible. Um, And also, when you think about the expansion, you want to make sure that you look into the funding and, of course, the financial aspect of how it can affect this company. And ultimately, the pros do outweigh the cons. Even though Virginia doesn't offer a cancer treatment program, programs such as Medicaid and, of course, Medicare does allow for treatment and preventative measures to be taken for cancer patients and of other illnesses that are very detrimental and chronic to patients. And so that is all I have. And thank you so much for attending. And I hope you have a wonderful day.